The Health Department says it's concerned about holidaymakers who will be returning to South Africa from neighboring countries that have been hit with a cholera outbreak. Currently, Zimbabwe has a deadly outbreak of the virus. The neighboring country has now declared a state of emergency after around 250 suspected cholera deaths were recorded last year. According to the government, the number of people killed has risen rapidly over the festive season. The Health Department says it has intensified screening services at the country's borders to prevent the spread of the disease. For more on this, we're joined by Health Department spokesperson Foster Mohale. A very good morning to you. Thank you so much for your time. There's a great deal of concern as holidaymakers make their way to South Africa, especially those from neighboring countries such as Zimbabwe. What preventative measures have you put in place?
Good morning, Mpho, and good morning to your viewers and compliments of the new season. Yes, as you correctly pointed out that as the Department of Health have noted the recent outbreak of cholera in the neighboring countries, especially in Zimbabwe. Hence, we want to appeal to all travelers who are returning from endemic cholera endemic areas to try to cooperate fully with our health officials at the ports of entry in order to prevent possible cross-border transmission of this disease. So working closely with the stakeholders like your border management authorities, the World Health Organization, we have intensified our health screening services and education at the ports of entry in order to ensure that we try by all means to detect and mitigate against the transmission of this disease into the country. As you know that even South Africa, we've battled with this cholera late last year, where a number of people lost lives. So we are trying by all means to avoid going back to that situation.
Can you perhaps expand more on how the planning is going to be roped out in terms of the logistics and the strategy you have in place? How many teams, for instance, do you have on the ground?
Yes, in fact, we've been closely monitoring the situation in Zimbabwe for the past few months through our system called surveillance system, which is a system involves collecting, analysis and interpretation of data, not only in the country but also at the neighboring countries, because as you know that the disease has got no boundaries. It can, as you know that the first few cases in the country were transported from the country of Malawi. So we try by all means to ensure that we had enough teams at the ports of entry, especially at the land. As we know that majority of people who are coming to the country, especially from countries like your Zimbabwe, Mozambique, and Malawi, they come through the land. So we try by all means to intensify our teams on the ground at the ports of entry in order to ensure that all people who are coming to the country, they get screened, and all suspected cases, we refer them to the nearest health facilities for testing.
Okay, so those suspected of perhaps presenting symptoms of cholera, where are they taken back into South Africa for testing, or how is the process working?
Remember, we only detect them while they're already in the country, so we will not deny anyone access into the country precisely because of a cholera status. All what we are trying to do is try to assist them so that they don't spread this disease further. So we refer them to the nearest health facilities within the country, because by that time they will be already in the country. So we try, hence we are trying to appeal to all those who are coming to the country to say, please try to be as transparent as possible. Even those who are coming from cholera endemic areas in Zimbabwe and other countries, says try to be as transparent as possible so that we'll be able to assist them and also assist other South Africans.
Let's go back to the question I asked you, Foster, about the processes and the strategy that's in place to ensure that testing is indeed done. I mean, you'll know that the queues are extremely long. People queue for up to hours at the border post, and a lot of people coming in buses. How are you going to ensure testing? I mean, is it a random selection? Are you stopping every bus and testing everyone? How are you going to do it? Because it doesn't sound like a thorough plan is indeed in place.
In fact, we are at the port of entry, we don't do testing, we do screening. Screening we do through the observation by looking at an individual looking at the signs and symptoms of cholera. But secondly, we also use the questionnaire as they come to say where you come from, which area of your country you come from, just to check if the areas that they come from are not endemic or are cholera endemic countries, areas, so that we are able to take further steps. So, of course, you are correct that people, they come in large numbers, but what we do, we just screening, also try to ask them the questions in order to establish whether they come from cholera endemic areas. Where we suspect that someone is displaying symptoms of cholera, that's where we are able to refer them to the nearest health facilities. But we also have the mobile clinics at these ports of entries in order to assist those who cannot be immediately referred to the nearest health facility. Okay,
so you're saying that there's not much control, and you're going to play it by chance when it comes to finding out how the process will work. Are you saying that you'll have to guess, perhaps, if a bus comes in from Zimbabwe and there's about 50 occupants within that bus, how are you going to ensure that you test it? And you also mentioned that you collected data. What does your data tell you about the spread of cholera within the various parts of Zimbabwe?
Look, yeah, we work closely with our counterparts in the country, both the health officials and the World Health Organization. So we compare the notes from time to time. We know which parts of Zimbabwe they are currently battling the spread of this disease, and also the morbidity and mortality rate in those areas. That's why we don't take chance. Yes, we are absolutely correct that we may not be able to detect all the cases, is precisely because if one is infected with cholera today, it takes at least 12 hours to 5 days for the signs and symptoms to be visible. Hence, we appeal to all those who are coming from cholera endemic areas to say, please try to cooperate fully with our health officials and try to be transparent, because we may not be able to detect all the cases, but it's only through collaboration with all the travelers that will be able to mitigate the spread, the cross-border spread of this disease into the country.
So according to the government in Zimbabwe, the number of people killed there has risen rapidly over the festive season. Are you saying that it's inevitable that the spread will, of course, be could be similar to what Zimbabwe is seeing in South Africa? Because from what you're saying, it sounds like a lot of people are going to slip through into South Africa undetected at the border because you can't screen everyone.
Not necessarily. If you remember how we detected the first cases in the country late last year, there were 2 travelers who went to attend a funeral in Malawi last year. But the signs and symptoms, they only experienced the signs and symptoms while they were already in the country. When they passed through the ports of entry, they didn't display any signs and symptoms. So hence we say it's not easy for us to say 100% will be able to detect all the cases. Precisely, some of the people may not know that they have contracted cholera. So hence we say, if you are coming from cholera endemic area, please try to cooperate with our health officials. And once you experience signs and symptoms, even once we have already entered the country, if we could not detect you or we didn't have the signs and symptoms by the time you cross the border, try to go to the nearest health facility for testing or further health management.
Very well. Thank you so much for your time there, Health Department Spokesperson Foster Mohale, giving us a sense of some measures which could be put in place at the border post when it comes to screening of cholera from those coming from neighboring countries entering South Africa.